Hello, I'm Dr. Gerald Appel. I'm a professor of medicine in nephrology at Columbia University Medical Center. I've run the Glomerular Kidney Center there for many years. And I'm here today to chat with a patient and friend of mine, Alonzo Mourning. Now, if there's somebody there who doesn't know Alonzo, I know a lot of you don't know me, but if you don't know Alonzo, not only has he been a famous NBA player, but he also was the center for our gold medal team in Sydney, Australia at the Olympics. He's also been a multiple time NBA blocking champion, and he also won an NBA championship with the Miami Heat while playing with a kidney transplant. So he's got quite a story to tell. So, Alonzo, it's just a pleasure to be here with you.
Likewise, Doc, it's an absolute pleasure. Always over the years that we've known each other, uh, since I was 30 years old. So it's been over 23 years now. And anytime I get a chance to spend time with you, it really brightens my spirit. And knowing what you've done to having a tremendous impact on my life, I'm very anytime I get a chance to thank you publicly, I want to thank you publicly for all that you've done. And also, Dr. Appel's a little modest, everybody. He's one of the best nephrologists in the world, by the way. He forgot to mention that. So,
Well, I'm talking to one of the best basketball players in the world.
all right, thank you, Doc. I appreciate it. So, long and short of it is that we both come together to have some dialogue and talk about uh, my history with kidney disease, a lot of the things, the knowledge that Dr. Appel knows about kidney disease, and and how he helped basically save my life. So it's a pretty interesting story. So I'm very excited to have this conversation. So that our audience can learn more about taking a step towards educating themselves on kidney disease.
That's great. So we're going to go through Alonzo's history with this, and you'll see it's different from other people because he was a world famous NBA player at the time, but it's similar to a lot of what you people are going through. So, Alonzo, can you start off by telling us what happened? How did you first notice and know that there was a problem?
Well, I found out that that I had some abnormalities with my kidneys. By first, some of the symptoms were lethargy, and I had swelling in my lower extremities. So I was extremely fatigued, and I was an athlete, a high performance athlete, and I was in great shape. So being tired and run down. Um, I was trained to kind of ignore those symptoms. I truly was. So I tried to push myself and play through it. And I'm gonna tell you, it was during the time when it was 2000, the year 2000, when we were in Sydney, Australia, competing to win a Olympic gold medal for the U.S. And there was so many different physical obstacles I was dealing with. But again, like I said, I was trained to kind of ignore those particular things, and I pushed myself through it. We ended up winning the gold medal, and then coming back from Sydney, Australia, I recognized a lot of swelling in my legs. So doing a preseason physical that I had to take at that particular time with uh, with my team, the Miami Heat, they ran a blood test, and they compared previous years physicals to the one that they had taken, and they found out that my creatinine level had increased. And creatinine is a gauge of your kidney function. It gives doctors a gauge of your level of kidney function, and mine was pretty elevated at that particular time. So that raised a red flag. And then they noticed the amount of water that I had retained and the swelling that I had in my body.
Yeah. And did they talk to you about the protein in the urine?
Exactly. Yeah, I had an extreme amount of protein in the urine, and immediately they recommended that I do a biopsy. And when I did the biopsy, that's when they identified that I had a rare kidney disorder called focal segmental glomerulosclerosis. It's a disease that slowly scars the filters in the kidney.
So, what did you know about focal sclerosis when they first told you? Did you know anything about? I mean, this is not the kind of thing a common term is. I mean, this is like something that people don't hear about.
Yeah, well, I didn't know anything about it, Doc. I was extremely scared. I mean, for lack of a better words, I was scared. I was fearful because I had this. This was somebody that I've taken a lot of pride over the years in keeping my body in optimal condition to go out and compete at a high level, and I think I did a pretty good job of it. But technology's advanced a lot more now, where they have been able to find more and more about focal sclerosis. And a lot of it has to do with genetic variants. And I've now that I know, and I've been educated, over the years, science has advanced tremendously. Now I found out that I had uh, this APOL1 variant, and people with the APOL1 variant risk face an increased chance of kidney disease if they have two variants. And now you're able to find that out just with a blood test. You're able to find out whether or not you have those two variants. And it's interesting. It's something that I learned that everyone has the APOL1 gene. It is present in many tissues, including the kidneys, and it's a part of the body's immune system, But uh, so there's a typical gene, or if you have the variant, and come to find out, I had those two variants, which were lying dormant in my system, and then something triggered it to wake up and start attacking my kidneys.
That's scientifically very good. This disease is more common in blacks. Their background is sub-Saharan Africa, and it increases scarring of all different types in the kidney.
Yeah, so it's to kind of put that in perspective, just to share with the audience, African Americans account for 35% of all kidney failure cases. So that's a big number. So just think of literally over 30 million Americans who suffer from chronic kidney disease. And then also, like you said, Doc, people of the sub-Saharan region of Africa, uh, they're more likely to carry this APOL1 variant than people that aren't from that particular region, and how you find that out is go and get a regular checkup. It's as simple as that. Just go and get a regular checkup and then and consulting with your doctor.
I will say that I think the most important advance we've had, aside from some therapeutic advances on treatment, but the biggest has been genetics. That look at the genetics for different people. And it is a blood test most of the time, but now in a lot of things it's just a cheek swab.
Oh, really? I didn't know that, doc. So I'm still learning.
So we both are. So how did you get to me? I mean that's always that was it changed your life, but it changed my life too.
Obviously, doc. And I mentioned it earlier. You're world renowned for the work that you've done in the field of medicine and kidney disease. I was fortunate enough to have an endless amount of resources being a professional athlete. So my agent, Jeff Wexler, his father-in-law was Norman Brayman. Norman reached out to the hospital and they gave him your name, and the rest was history. And immediately, because Jeff and I sat down, and after my biopsy results came back, we sat down and we just started mapping out a strategy. And we said, hey, man, I got to find the best kidney doctor in the world. So we did our homework, and then we found you. And unbeknownst to us is that they had during that particular time, you were on your way up to this convention, that an annual convention that doctors have, nephrologists have from all around the world. And we were able to send all of my lab results and all of my information to you, and you took it to that. I think it was in Canada, if I'm not mistaken.
It was in Toronto.
It was in
Absolutely.
Toronto, and then you were able to get some feedback from some other doctors, which allowed you to kind of get a better understanding of the right approach to take for me. And I was very grateful and fortunate enough to have you in my corner at that time, because I didn't know which way to turn. I really didn't. So when we found you, that's when you flew down to Miami after that convention, and we got together with Pat Riley and my family and my coaches and my all the people that I confide in and that I trust, and then we had to make a decision for me to retire at that particular time.
I remember that very well because I was eating dinner out at a small restaurant which had a TV set on it. And at that meeting, they had said that they were going to send your biopsy and everything up. And there in the bottom of the TV, it said, Alonzo Mourning will not be playing basketball this year. At, and it wasn't actually after the meeting that I went down. I went down to your place in the middle of the meeting. That's how important this was. I went down in the middle of the meeting that came down there. I will say that at that dinner meeting, that when I came into the room, everybody stood up around the table, and the shortest guy in the room, aside from me, was Pat Riley, and he, of course, he played for the Lakers. That it was a tall room.
What alarmed me more than anything was the numbers, the volume of people that was affected by kidney disease that I did not know about at all. So I immediately kind of educated myself on all the things that doctors knew. And at that particular time, while the momentum was going behind the world knowing that, okay, I had to step away from the game because I had kidney disease.
So another big thing in terms of our course together was your kidney transplant.
Right.
Tell us about how this came about, that you needed the transplant, and what it was like having a kidney transplant.
Well, you know, it's it's amazing how the body adapts to, like, if you got a headache or you're feeling bad in some type of way, and it's consistent over time, you just adapt to it, and you just keep living. You keep going to work. You keep getting your kids ready for school. You just keep going on with life as it is, dealing with the discomfort. And the reason why I'm mentioning this is because I didn't receive a transplant until 3 years later. With your help, you slowed the progression of the disease down with medications. You slowed it down. And I was learning, and I was still playing ball. I went back and played ball again, and I was learning to deal with being uncomfortable. Okay. And then when I got my kidney transplant, it was like the very next day, I felt like a new person. It's like, it was absolutely amazing. So that's the only way I can kind of describe it. Now it's my job to listen to the doctors and to take care of myself, to eat right. I eat a plant-based diet. I exercise 4 to 5 times a week. I drank a lot of water. I'm doing all the things I need to do to take care of my bodies. And now, thank God, December the 19th, I celebrated 19 years post-transplant. So you enlightened me and told me you have patients that are 40 years into their transplant. So that's my goal, to reach 40 and to keep going. So but when I got my transplant, I felt an immediate difference, and And I credit you, Dr. Pell, again, for basically saving my life, because uh, I didn't see basketball as an option, when I got the news that I had to retire and I was going to need a transplant. And during the surgical procedure, they usually cut the abdominal muscle in order to get the kidney in there and attach it to that huge artery for blood flow.
How many people would call you from the operating room and say, I'm going to have to cut through this muscle. I can't get down there to get the kidney in. And I said, no, no, don't cut it. Find a way, squeeze it in terms of, but again, that's how important it was.
You all decided not to cut my abs because you all felt like, hey, I'm going to need these if I decide to come back and play ball again. So that was you all making that decision for me, allowed me to be able to come back and win a championship with the Miami Heat in 2006.
Well, this tells us a lot about Alonzo's personality. You can be tall and be a good athlete, but you have to have determination. And I was absolutely amazed when we decided that Alonzo was going to get the transplant, that he had to stop playing ball until he could get a transplant and everything. 15 minutes later, he was, okay, let's go. When can we get a date? When can we get my donor worked up and everything? I mean, just plunged right into it. So, that attitude really makes a huge difference.
Very
And
much so.
he takes care of himself.
That's what it was. It was about, okay, if this is what I got to do to live, then so be it. Because it's a whole lot of other people out there that has it a whole lot worse. So if this is all I got to do, just take them and take care of your body and move on. The one thing about dealing with any type of health obstacle, especially with kidney disease, you first got to understand that the body follows the mind. Because if you give up here, then the body will follow that. Second, you and your doctor have to have a strong relationship. You do. You have to have a strong relationship and you got to trust your doctor and listen to your doctor. Number three is that you got to take your meds on time. You do. You got to take them. You got to take your meds. And number four, you have to be an active participant. You can't wait for nobody else to do it for you to take care of your body. All right. You got to eat right. You got to get your rest. You got to exercise when you can. You got to keep your body moving.
So, Alonzo has been a unique patient because he's an athlete, because he's so determined in everything. But I have to go way back to the beginning and tell you one thing he said, which has stood out in my mind ever since then. So we're talking way back, right at the time of the Olympics back then when he was first seeing me as a patient. And that was, he said, and I think it was at a news conference, he said, I'm just like everybody else. I just want to see my babies grow up and I want to do what I love. That is play the game of basketball. And, everybody has different goals in life but if you're determined, if you work with your doctor, if you work with the modern medications and everything, you can do that. And, I'm not sure that I would have given him the right answer if I told him back then what was going to happen, but it couldn't be a better course. I mean, not only has he seen his babies grow up, but I've seen his babies grow up.
We take a lot for granted. We really do. And health is everything, man. I can't emphasize that enough. So it's important for you to not wait for something to happen. It's important for you to be proactive and get a checkup. Go to the doctor and have a great relationship with your doctor. Do your family do some research in your family history, and does anyone in your family have kidney disease? But being an active participant in your health is key. It truly is. With Vertex, my partnership with Vertex, we have an initiative where we've created a website called Power Forward Together. And I'm gonna tell you, we're powering forward together to help others in the community know the risk of the APOL1-mediated kidney disease and to take action with their health. So I want to encourage you all to go to powerforwardtogether.com. And you can gather as much information as you can. You'll see my beautiful face on the website as well. And I'll also be talking with you as well about my history of kidney disease. But it's an educational site for you to go on and for you to learn more about the APOL1 variant and the gene.
You know, it's sort of amazing to think back to that first news conference and everything and where we were back then, 20 something years ago, that and think that now you've become a major advocate for kidney disease.
Yeah.
That, in terms of, telling people, and this is just not Alonzo's disease, focal sclerosis.
Listen, power forward together. That means coming together and doing it together, having open conversations with your doctor, your family, about your health, your family history of kidney disease, all these things. Figure out what's going on in your body. If you have any of those symptoms that I talked about earlier, lethargy, swelling in your legs, uh, tired, exhausted all the time, any of that stuff, you go to the doctor, please. Don't ignore it. Don't brush it off, because it could be something a lot more alarming than what you might think it is.
I will say that, one other place that you can always go to is the National Kidney Foundation site. The NKF has done a wonderful job. I'm going to be going next month out to their national meetings in Austin, and I have lectures on just about every glomerular disease you can think of, diseases of the filters, in terms of this, informing the doctors who will then go back and take care of the patients. So this has been a good advocate site for patients, who any type of kidney disease, but certainly diseases of the filters.
And some of the questions that you can ask your doctor is how do I get tested for kidney disease? What is the process of getting genotype for the APOL1 variants? If I test positive for kidney disease, what would you recommend the next steps be? Is there a specialist that you recommend that I go see? What are ways I can continually monitor my health, or what other signs do I look for in the worsening of my kidney function? Uh, are there any lifestyle changes that I need to make? There's just jot down all of those things that I just said, so that you can ask your doctor those questions, but be engaged, be proactive, be confident. All right. Be brave when you go in there and understand, you're doing the right thing. You truly are, and it's a little doubt and a little fear. It is always, because I was scared. I was 6'10", 6% body fat, all muscle, and to some people I was this menacing figure, but I was scared. I really was. I was scared because I didn't know what was going on. But now that I've educated myself on what was going on in my body, I feel so much more confident, and I'm ready to tackle this. That's what it's all about. Yeah, and remember, the body follows the mind.
Well, I wish every patient had that same attitude in terms of this, but many do now. I mean, because they're more aware of kidney disease. And some of the signs, are that, for instance, if you go for your routine physical and you have protein in the urine, or if your blood pressure is elevated, or if your blood test shows that there's abnormal kidney function, those are the things for you to tune into very quickly and get to your doctor.
But also, Doc, you mentioned something about urine. Usually people with kidney disease and they're spilling a lot of protein, you go to the bathroom, they have a foamy urine. They have foamy urine. So that's another thing to look for. If you go to the restroom, you see a lot of foam, a lot of bubbles, then that's a red flag also.
I want to put one caution on that, because when I tell the medical students, the first year medical students, that there's always 2 or 3 people who said, "Oh my goodness, there were bubbles in the toilet. I must have protein in the urine." There are always bubbles when urine hits the toilet water, but they don't break apart if there's protein. They stay there like a head of beer. It just looks like you've got a beer there with the head of the beer with the foam and everything. So that is a red flag, like many of the other things. But again, you can go to the Kidney Foundation site and find all about this. Talking to other patients who have gone through transplant. I got a letter today, literally today, from a patient of mine who moved to Tacoma years ago, but every year I get at least 1 or 2 letters. She's 41 and a half years out. She wanted to know if she's my longest transplant. She isn't, but she's the longest with just one kidney. I have somebody who's longer, who got a kidney that didn't work, and I had one that worked for 38 or 39 years already. So, and Alonzo did not retire due to kidney disease. I mean that some people say, oh well, his kidney disease and the transplant. No, he would have kept on going, I think.
I really would have, because I felt so good. I really did. I felt good, and then the beauty of it is that I was continually keeping my body in shape. I was taking my meds on time, and I was staying hydrated. So developing those habits were key, truly key. But going back to the education part, and helping people understand, so I don't want you all to be on this island alone, to be by yourself. So, Dr. Appel he mentioned National Kidney Foundation, I mentioned powerforwardtogether.com. These are sites that you can go to get the information that you need. And then also, if you got a great relationship with your doctor, please, you know, go to your doctor, ask the questions, that I mentioned to you. How do I get tested for kidney disease? What is the process of getting genotype for the APOL1 variants? If I do test positive, what do I do? What would you recommend the next steps? Just all these are the questions. Is there a specialist that you recommend? All these things are questions that you can ask, so don't be fearful. Go in very confident, knowing that you're taking charge of your health. You're taking charge of it.
Yeah. And if your doctor says something that you don't like, you can always get a second opinion because, again, this is your life that's going on here. So, you need an explanation of what is happening here. And I think that's one of the areas that doctors have to work more, explaining it at a level that a regular person can understand. I mean, Alonzo's had 20 plus years to understand this disease, and he knows more about it than a lot of certainly more than any non-nephrologist, and a lot of nephrologists too. But this is important, that you understand your disease in terms of this, so you know how you can help yourself over time.
Yep, yep. And you know what? You just mentioned, Doctor, how much I know, because, you know, I always talk about, I use this as an analogy, when you walked into a classroom and you had a test to take and you didn't study, you felt unconfident, you felt fearful, you felt embarrassed, you felt unsure, you had all these feelings. It is no different than not educating yourself on your health. You know, you're unsure, you're fearful, you're doubtful, and all those things. But as soon as I started educating myself on everything that the doctors knew, and I asked questions, I became even more confident that I was gonna win. I was gonna fight this if I took the necessary steps and making the adjustments in my health and taking my meds on time and eating right and exercising and all those things. Those are the things that I needed to do. But the adjustments that you make, and and doing the things you need to do to really be proactive and take care of your health is so key.
Another important area to discuss with your doctor, especially if it's a nephrologist, is clinical trials. Clinical trials to lead to new discoveries, and they lead to all the research that's helped patients in so many different ways. Alonzo, you were involved in a trial that got you genotyped. How did that happen?
It was pretty much based on your recommendation, Doc. And it helped with the further advancement of uh, the medical science, behind um, finding out more about kidney disease. What I recommend, and it was recommended to me from my doctor, Dr. Appel, is that you want to speak with your doctor about seeking a genetic test to confirm whether you have the APOL1 risk variants. This process is called genotyping. So those of y'all that don't know what genotyping is, and it's conducted through a blood test, you can talk to your doctor about that if that's what you choose to do. And again, it kind of helps further along the advancement of the education on kidney disease.
If you have a family history of kidney disease, if you're African American, sub-Saharan descent in terms of this, so all these groups would benefit, And again, as Alonzo joined a clinical trial, I mean, trying to find out more about your own disease and everything, and trying to help discover new medications and other things.
Yeah, so the clinical trials are key. It really is. All it is an information load for our doctors and our scientists, to make better decisions towards helping with kidney disease. It truly is, So you being a part of genotyping and clinical trials is very helpful in that process, So the three things Dr. Appel said: we're going to power forward together, take charge of your health, know your family history. Does anyone in your family have kidney disease? If you're African American or from the sub-Saharan region, you're automatically a candidate for one of those variants. The third thing is to go to your doctor. Doctor visit. Try to get educated. If you do have any of those symptoms or what have you that we talked about, the swelling, the lethargy, the foamy urine, all those particular things, those are red flags. Don't ignore them. Go to the doctor and start the process. Truly start the process.
Yeah. And I would add at this point, think positive. Nowadays things are so much better than they were. That they were better than they were when Alonzo first developed his disease, and even when he did, it was much better than 20 years before. So the progress has been tremendous here.
That was over 22 years ago, Doc.
Just
Over
amazing.
22 years ago that I developed my disease, and look at me today.
Yeah.
Through the advancement of medicine, through my participation in genotyping and getting tested and being a part of those studies, all of that stuff has helped advance medicine even more to help change the lives of people.
Well, this has been a wonderful chat here. I mean, educational for us, and I hope for you as well. And I'm going to turn this back over to Alonzo now, and just some final words here that after that great discussion.
I want to ask all of y'all again to take charge of your health. Be an active participant in your health. Okay, don't wait for nobody else to do it for you. You do it yourself. Be proactive. All right, and remember, the body follows the mind. If you give up mentally, the body will follow that. And visit powerforwardtogether.com. This was very rewarding for both of us. I know I speak for Dr. Appel. This is very rewarding being able to share our story because I know that we have taken a huge step forward today. If we have educated you and helped you take a different approach to your life. All right. God bless you all.